There is no doubt whatsoever that New Zealand's healthcare system is in crisis. And today, Te Whātau Ora will announce how it plans to tackle massive backlogs in our emergency departments. But it comes too late, sadly, for the parents of 4-year-old Sebi Chua, who died in Wellington Hospital last month, 4 years old, after being misdiagnosed and wrongly prioritised in the view of his parents. So what do those on the front line see? What's it like out there, and what do they want to see changed? Australasian College of Emergency Medicine's New Zealand chair, Kate Allan, is with us now. Kate is a frontline doctor as well. Kate, if you could begin by telling us, emergency departments have always been highly complex and difficult to work in, so thank you firstly for your mahi. But what is it actually like out there for a doctor like yourself at the moment? What are you seeing day to day?
Morena Peri. Listen, thanks for that. And I would really like to start by extending our condolences to the whānau and the loved ones of the child that died, and also support to all the healthcare workers that would have been affected by that death as well. Our teams go to work every day to do the best job they can and provide the best care they can to the patients, and that can sometimes be incredibly challenging for many different reasons. It's complex, and it's not just, there's no simple solution. So just to start by saying that. And as I said, it's an incredibly challenging time at the moment. At times it can be frustrating and overwhelming, especially when our demand is outstripped by the resource that we have. But when we are working in a resourced environment, it is an incredibly rewarding career to be in.
Yeah, because at the moment, and I'm looking at some official figures out of Te Whātau Ora right now, 50 nurses short across Auckland, including where you're working, 50 nurses short, including up to 25 actually in Middlemore alone. Down in Wellington, where that tragedy has just happened, 25 nurses short in the emergency departments across Wellington, and 15 short in Christchurch, where there's also been a recent tragedy in the ED. When it comes to resources, and we're talking people here, do you not have enough people? Do you not have enough nurses?
Clearly, we don't. They're short. And this has also been impacted by, there's increased sickness. People are burnt out. Our nurses particularly are burnt out, and there are better opportunities overseas, so we are losing staff. So this is really about working together to work out how we can value our workforce, how we can retain our workforce that we have. Especially, there's so many people that contribute to our work in the emergency department, but we cannot do it without our nurses, and we need ways to enable them to be there, to turn up to work, to want to come to work every day, and to actually find it a really fulfilling career to be there and to help our patients.
Yeah, 50 nurses short in EDs in Auckland. You know, personally, I find that a little scary, and I'm sure a lot of other people watching will as well. I know you do your best. You know, we've got the best doctors and nurses, but is that scary for you as well, you know, being so many people short out there?
It's incredibly challenging. I think, we do what we can with the resource that we have while we're there, and it does absolutely put huge pressure on those that are there and working, and it's incredibly frustrating for our patients who are there to receive care, and sometimes our staff bear the brunt of that, and that can be really, really difficult as well. It can be a very difficult environment to work in, and there's no immediate solutions. There's no quick fix here. This is looking at long-term how we make this better. And we need, first of all, we do need workforce. We need the workforce there at the level that it is now, but also growing into the future. As our populations grow, as we get busier, we need more workforce. We need to keep training people to come through the system.
Yeah, so you're saying what we're seeing on the front line at the moment is a systemic problem. It's not just, oh, look, we don't have enough nurses and doctors at the moment. What, you sort of seem to be saying that it's a systemic issue that goes back years?
This is absolutely a systemic issue that has been through successive governments for many years, and it has been building, and COVID was not the cause of it. It may have broken the back of it, and exposed it, but it's definitely not the cause of it, and it's not the ongoing problem. This has been in the system for a long time, and it's just reached a real crux now.
Yeah, so when we hear, oh, you know, it's the flu, it's COVID, it's winter, it's not actually that. It goes back years and years and governments, by the sounds of things, just running the system down into the current state it's in.
Essentially, yes.
Yeah, okay. And, you know, that's a concern, isn't it? Because how do we fix that, you know, if we bring in...
It is a real concern, but I think we all have a role to work together to fix this. It's not just about government, it's about all of us working together to come up with solutions. The people who work on the front line, we are there, we're seeing it. The other specialties within the hospital system, aged residential care, community care, all our ancillary support, you know, the physios, the occupational therapists, there's so many people in this system, and we all can work out ways that we can make this better to fix it. And I think it's really important that those voices are heard.
Sure, and very quickly, because we've got to wrap, if there was one thing that you could get from the government today, one thing, what would it be? And be quick, please.
I don't think there is any quick solutions. Look,
yeah, that's the problem out there, isn't it?
Yeah, there's no quick solutions. There's a lot that we can ask for and that we can support, but we do need. This is about working together.
All right, thank you very much, Australasian College of Emergency Medicine New Zealand Chair Kate Allan. Thank you so much, and thank you for what you do out there on the front line.